We're talking about pacemakers. Everybody wears these things, it seems to me, these days. I hear about it all the time.
Yeah, they're pretty common, and the reason why people need them is because we have, occasionally people will have heart block or they will have a slow heart rate, and this happens with age and with other risk factors. It's not too uncommon that we see. We have an electrical system in the heart which sends the signal from the top part of the heart to the ventricles, and the top part squeezes and then the bottom fills, and then the electrical signal goes to the bottom and gives us our blood pressure and squeezes. Sometimes in that conduction area we get a block or it frays or you get a short in it. And the pacemaker is little wires that we put into the heart, maybe 1, 2, or 3 of the chambers even now, to where it gives a little signal to the heart which tells it to pump.
Are there temporary pacemakers? Are there permanent ones? How does that work?
It's a great question. There are two types, and that's exactly what they are. There's a temporary pacemaker that we'll typically put in emergently if somebody has complete heart block and we're there at the bedside and we have to do it immediately. And then there's permanent ones, and some people go temporary and then need a permanent, but if a temporary pacemaker for something that could be fixed in the temporizing measure or in the short term, then you can pull it out and their heart comes back. But if they continue to have it, then they need a longer term one.
And if you have a pacemaker, how does this affect your lifestyle after the surgery when you install it?
So it's a fairly minimally invasive procedure. It typically will go in the top left of the chest wall. It's a small little battery with a computer in it, and the wires are led down into the heart. And the wires look and see what the heart's doing. And once it's in, after 4 weeks, people can typically go back to golfing, doing whatever they would like. There's certain things that they need to stay away from for prolonged times. They have cell phones in their left pocket, then we ask them not to put them there, and other rare things such as arc welders, but typically.
But they'll improve the life of the person who's wearing one, that's for sure.
Yes, they will.
All right, Dr. Tim Malins, thank you.
Thank you.